The Louisiana Health Department warns of a big increase in whooping cough cases that could result in a record high this year.
Sabrina Wilson reports the department urges the public to take precautions.
So the Louisiana Department of Health has identified 164 cases of pertussis or whooping cough in the first 4 months of this year. And that's compared to 153 cases that were reported in all of last year.
Whooping cough can seem like the common cold, but then escalate to coughing fits.
They can be so strong that people, after they experience a coughing fit, will have to gasp for air.
Teresa Sokol is state epidemiologist.
What we're seeing now with whooping cough, but also with other types of respiratory diseases, is sort of a return to pre-pandemic levels. What we're seeing in Louisiana, though, is a level of activity that's even higher than what we saw before the pandemic.
Because pertussis is so contagious, it can affect anyone, and some people end up in the hospital because of it.
Since we first started seeing this increase in cases, 40 Louisianans have been hospitalized for whooping cough, and 70% of those hospitalizations have been among babies younger than 1 year old.
Small children have very narrow airways that are more prone to obstruction.
Teens and adults, they can also get complications, for example, pneumonia from whooping cough, but they're less likely to be serious in these older age groups.
Is pertussis seasonal?
Pertussis is a bacterial disease, and it typically does not have a seasonal pattern.
Her advice for pregnant women?
The very best way to protect newborns from pertussis is for pregnant women to receive a whooping cough vaccine during each pregnancy.
LDH's overall message to the public:
whooping cough vaccines work well, and they are the best way to protect against whooping cough.
It's given to young infants at 2, 4, and 6 months of age, and then to toddlers at about 18 months of age, and then just before a child starts school, typically at 4 to 5 years of age.
LDH says parents should review their children's immunization history to make sure they're up to date on their pertussis vaccines, and it recommends hand washing by all and that people cover their mouth and nose when sneezing or